The death of George Floyd in Minneapolis last year has led some cities to re-examine their policing methods. San Francisco is 8 months into a program designed to do just that. Street crisis response teams have been assigned to handle nonviolent 911 calls that involve people dealing with mental health crises. The teams have been concentrated in areas known for their homeless populations and for people suffering from mental and behavioral issues. CBS News correspondent John Blackstone explores the program for CBS Sunday Morning. Here's a preview.
Now in San Francisco, many calls to 911 no longer bring armed police officers.
How you doing today?
Instead, dispatchers send what the city calls a street crisis response team, trained to deal with mental health issues. Stephanie Cheery, a behavioral therapist, is on one of those teams.
When someone is experiencing a mental health crisis, especially psychosis, it can look scary to somebody to see a person who's talking to themselves or yelling into the sky.
It's scary, you call the police.
And now you can call and ask for us, too.
And John Blackstone joins me now for more. John, good to see you. Tell us more about these crisis response teams. Who makes them up, and how are they equipped to handle 911 calls versus the police?
Generally, these response teams have a behavioral therapist, as you saw there, someone trained in dealing with mental illness, mental distress. There's a paramedic from the fire department for treating medical issues. The most interesting members of the team, I think, are what are called peer counselors. These are people often who are formerly homeless people, perhaps a recovering addict, someone who knows what it's like to live on the streets and sometimes be confronted by law enforcement when they're in distress. These are people who, they've been there, done that. They can talk to people living on the streets in language that they understand. Say, I know what this is like. I've been there.
It's a very interesting aspect of it. But walk me through the mechanics of it. If somebody calls 911, how is it determined whether a law enforcement team or this crisis response team will show up to an incident?
The street crisis teams are meant to respond to what are known in police radio language as 800B calls. An 800B call is someone who seems to be in mental distress but is not armed, doesn't appear to be dangerous. That's who you send these teams to. Amazingly, in San Francisco, there are something like 50,000 calls like this each year. And that's a big job for the police. This is a task that's being taken away from the police largely as the number of these teams increase.
So how has the city of San Francisco been gauging the success of this program? Have officials noticed fewer situations that escalate to violence or arrest?
It's early on to actually come up with numbers in this. They're still adding to the teams. By next month, they hope to have 6 teams like this on the streets of San Francisco in the parts of town where these 800B calls most often come in. But certainly this is a response to calls for police reform that we've seen across the country. And that's really what we're looking at in this entire Sunday morning broadcast, are what are some of the solutions to policing, some of the things that work in the United States, some of the things that are working in Europe and Japan, how policing differs around the world. That's what we're doing in this Sunday morning broadcast, is looking at many of the solutions to this. It's an issue the broadcast has been following really for the past couple of years with pieces many weeks. But this program focuses on largely solutions, how things can be done differently.
I think people are going to be eager to see that. I'm also curious, though, John, as you mentioned, 50,000 of these types of calls come in every year. I wonder what has been the response to this from the San Francisco Police Department. Has there been any resistance to the program? Are they glad to have these calls taken off of their plate?
Certainly, officially, top officials in the police department have said, yes, this is helpful. Because, again, 50,000 calls a year to the police for something that really the police are not equipped to handle. Their job is solving crime. They come across someone in mental distress. The police have 2 tools that they can use, really, and that is, one, to arrest them. Usually these people have not actually committed a crime. The police can't arrest them. Or if they're in such mental distress that they do appear to be a danger to themselves or others, they can be committed short term. But those are the only two things police can do. Usually the police show up, perhaps try to calm someone down, and then leave. What people on the street told us, we were looking at this story, what people on the street told us is when a police officer arrives, someone with a gun on their side, that's more likely to escalate things than de-escalate things. When these teams show up, again, with someone like a peer counselor who can walk up and say, I know what your life is like, that can help de-escalate.
All right, John Blackstone, appreciate you coming on and looking forward to your reporting.